This is Healthcare Today with your host, Kelly Roberts.
Welcome to Healthcare Today. In today's show, we'll be talking about an array of cancer awareness topics. My first guest is Dr. Esther Tan, hematologist-oncologist with Archbold. Welcome, Dr. Tan.
Hi, Kelly.
Thank you for being here today, and I'm excited for us to talk about all things cancer awareness. Now, I'd like to start off, and let's talk about what are the most common cancers that you encounter as an oncologist.
So the top 5 cancers that I encounter in my practice are breast cancer, lung cancer, prostate cancer, colorectal cancer, and melanoma. And that goes along with the incidence of cancers in the United States.
You know, today's all about, bringing awareness. And so I want to talk a little bit about early prevention and these screenings. So let's start off and talk about what are the guidelines for cancer screenings for each of these.
Kelly, there are different organizations that come up with their own guidelines. So there are some variations to these guidelines I'm about to talk about, but I will talk in general terms. I think most of these organizations do agree on certain things, so I'm going to talk in general terms. For breast cancer, we agree that women over the age of 40 need to have some screening. Mammogram, for instance, is a tried and true screening study.
Okay, and is that important, even that first screening, at wherever you have that first one, it's important to have that as a baseline, correct?
Correct. It is very important to have one as a baseline because younger women, they have more changes in their breasts that may be suspicious. So always, not usually, but some women with their first mammogram may get a call back to get an ultrasound because of those changes because they are younger. So it is good to have a baseline mammogram for future comparison.
Let's talk about some warning signs just in general that people should be aware of.
For breast cancer specifically, I think any changes in the breast, any breast lumps, any discoloration, if the skin looks abnormal, that should be warning signs. Any unusual lumps or bumps, especially underneath the armpit, the axilla, the neck, those are warning signs that they should present to their primary care provider. There's also colorectal cancer screening, and the gold standard is a colonoscopy every 5 to 10 years. Other cancer screening studies are for cervical cancer. Again, women in their 20s, early 20s to mid 20s, should start thinking about cervical cancer screening with a pap smear and human papilloma virus testing. Melanoma screening, definitely being aware of your skin and going to see a dermatologist or primary care provider for a skin check. Prostate cancer typically starts around age 50, and this is a discussion with your primary care to get either PSA or a digital rectal exam for prostate cancer screening. Last but not least is lung cancer screening. Patients who smoke for 20 years for a pack a day or 40 years, half a pack a day, should get a CT scan, a low-dose, non-contrast CT scan at the age of 50, starting age of 50 to screen for lung cancer.
And as far as risk factors go, are there any lifestyle changes and choices we could make to lower our risk for any of these cancers?
Absolutely. I think we all probably know that smoking is associated with a lot of these cancers. So the most important lifestyle modification a person can make if they smoke is to stop smoking. Alcohol can also cause certain cancers, so drinking alcohol in moderation. Exercise and having a healthy weight is also another lifestyle modification a person can adopt to help decrease the risk of cancer, because obesity has also been related to increasing cancer risk.
Dr. Tan, with your years, being a hematologist-oncologist, how have you seen treatment options advance with treating these cancers?
So Kelly, It has changed so much over the years. I started this journey as a medical oncologist almost 20 years ago, and things have changed tremendously in the past 20 years. We used to use chemotherapy to treat cancer, but that is not the only answer these days to treat cancer. We have immune therapy, which uses the immune system to treat cancer. We have pills that target mutations in cancer cells. We have radiation therapy. We have very precise radiation therapy, not just whole brain radiation or whole body radiation. These are radiation that's very precise. We have improved surgical techniques, minimal invasive procedures that can preserve the structure of a patient after the cancer has been cut out.
And from your perspective, catching these at this early stage, they have a better prognosis?
100%. If we catch a cancer cell when at early stage, their survival increases. It allows us to treat the patient with therapy that is less damaging to the body. It allows the patient to have a smaller surgery. And some women don't even need chemotherapy after. If we do find, for instance, breast cancer early stage, they may not need chemotherapy. All they need is a very small surgery, radiation, and maybe just a pill.
And then what advice would you give someone newly diagnosed with cancer?
My advice to them is that they're never alone in their journey. We work as a team to take care of our patients here at Archbold Cancer Center. From the medical oncologist, which is me, to the surgeons, to the radiation oncologists, to our nurses, to the pharmacists, to our navigators. We all work as a team to help the patient. They are never, ever alone. Even if they live by themselves, they're never alone. We are a family. The minute they have a cancer diagnosis, they become part of our family. We are here to take care of them. They should ask questions. They should listen to our advice. And they should not be afraid of cancer, because we have great treatments these days that are highly successful, and that there's nothing to fear. We are treating cancers like we're treating somebody with high blood pressure these days. So that's what I would like them to know.
Great, that's great. Well, I appreciate your time joining us today.
Thank you.
Stay tuned and we'll be right back.